Well, it's our 50th year. We are engaged in our 50th year anniversary. Our
Happy
birth,
50th. That's right.
thank you. Our birth was in the Occupational Safety and Health Act of 1970. And that act is the statutory beginning of NIOSH. It's the act in which NIOSH was established.
You're listening to What's Work Got to Do with It, your go-to resource on all things workplace safety, health, and well-being. This podcast series invites you into the conversation as we discuss how our workplace conditions like work hours, occupational stress, job safety, and other issues affect our lives at work and at home. We go into the science behind it all and talk about what we can do to reduce work-related risk and promote well-being. Thanks for joining us. This podcast is a production of the Oregon Institute of Occupational Health Sciences and Oregon Healthy Workforce Center and is produced by myself, Helen Schuckers, Nicole Guilfoy, Sam Greenspan, and Anjali Rameshbabu. Today we are joined by guest Dr. John Howard, the Director of NIOSH. He'll dive into the history and talk more about the agency and its roles in the lives of working people. This year, we're celebrating the National Institute for Occupational Safety and Health, NIOSH's 50th anniversary. Since April 28, 1971, NIOSH has funded research, education, and resources in occupational safety and health. Congress passed the Occupational Safety and Health Act of 1970 that created NIOSH to assure so far as possible every working person in the nation access to safe and healthy working conditions. Dr. John Howard is the Director of the National Institute for Occupational Safety and Health and the Administrator of the World Trade Center Health Program in the U.S. Department of Health and Human Services. Dr. Howard was first appointed NIOSH Director in 2002 during the George W. Bush administration and served in that position until 2008. In 2009, Dr. Howard worked as a consultant with the U.S. Afghanistan Health Initiative. In September of 2009, Dr. Howard was again appointed NIOSH Director and was reappointed for a third 6-year term in 2015. Prior to his appointments as NIOSH Director and WTC Health Program Administrator, Dr. Howard served as Chief of the Division of Occupational Safety and Health in the state of California's Labor and Workforce Development Agency from 1991 through 2002. Dr. Howard earned a Doctor of Medicine from Loyola University of Chicago, a Master of Public Health from the Harvard University School of Public Health, a Doctor of Law from the University of California at Los Angeles, and a Master of Law in Administrative Law and Economic Regulation, and also a Master of Business Administration and Healthcare Management, both degrees from the George Washington University in Washington, D.C. Dr. Howard is board certified in internal medicine and occupational medicine. He is admitted to the practice of medicine and law in the state of California and in the District of Columbia, and he is a member of the U.S. Supreme Court Bar. He has written numerous articles on occupational health policy and law.
Dr. Howard, thank you so much for joining us today.
It's a pleasure for me to be here with you all.
So a note to our listeners, as always, we publish information about our guest on the website. And looking at your background, you have degrees in medicine and law and business, and this is your third term as NIOSH Director, and having been through some really landmark events. So I guess maybe prolific isn't quite the word to capture it all, but
no, I think perpetual student maybe is closer.
That's good, perpetual student. So moving into just a reflection of this past year, it has been quite an experience, right? For everyone, of course, but I would imagine, especially for you in your role leading NIOSH through the pandemic and its impact on the workforce. So as we open this episode, I hope it's okay to ask, how are you doing?
Pretty good. I think, as you say, it has been quite the year throughout 2020. What I think is very interesting to reflect on is that NIOSH primarily does issues of the workplace that involve chemical hazards, physical hazards. Rarely do we get involved in biologic hazards. And this past year, we have done nothing else but get involved in biologic hazards. Now, NIOSH, as everybody knows, approves, certifies respirators. Respirators are a way for healthcare workers and others to protect themselves from a respiratory virus like SARS coronavirus 2. So in that sense, probably the leading edge of NIOSH during the COVID-19 pandemic has been our respirator approval processing, which is in our National Personal Protective Technology Lab, which is located in Pittsburgh, Pennsylvania. Folks who have worked in that laboratory have been 24/7 now for over 15 months. So that has been probably the part of NIOSH that has worked more often and engaged in more work during the pandemic. Another part of NIOSH that has worked in this area is, of course, our new masking protections, which are not respirators. And questions have arisen, do masks protect one from respiratory viruses? Another part of NIOSH, the Health Effects Laboratory Division, has conducted a number of research projects looking at the mask from both source control, how well does it protect the individual who has the mask on from the respiratory jet, if you will, of expelling particles, and then how well does it protect the wearer themselves, sort of personal protection. And so the Health Effects Laboratory division in Morgantown, West Virginia, has done research in that area. The rest of NIOSH, we've been like everybody else in every other workplace, trying to figure out how we do our work. For folks that do field investigations, that has been really hard because we can't travel. And oftentimes the workplaces that we would have studied are not active. For our laboratorians that work in laboratories at NIOSH, with the exception of some of our research that's been going on in face coverings, those folks have had to stop the research. And only recently we've been able to, through vaccination of our own workforce, to be able to get some of that restarted. So a lot of NIOSH work has paused this past 15 months.
So, Dr. Howard, you went into a lot of details with that, which is fascinating, I think, as we learn exactly how an event, a pandemic like this even impacts your work. And maybe, I'd love to go into more detail on more of those points, but how about we begin with an introduction to NIOSH for our listeners? So what does NIOSH do? Because I think you touched on those in what you just said, and it would help a lot to understand the full role the agency plays in people's lives.
You know, it's our 50th year. We are engaged in our 50th year anniversary. Our
Happy
birth.
50th. That's right.
Thank you. Thank you. Our birth was in the Occupational Safety and Health Act of 1970. Mm-hmm. And that act is the statutory beginning of NIOSH. It's the act in which NIOSH was established. And the framers that worked on that act decided that the regulators, the enforcers, the standard setters should be in the Department of Labor, but that the science that supported standard setting should come from the Department of Health and Human Services so that they would be independent. Scientists would be independent to be able to offer independent views on the science to the Department of Labor. The framers thought that being in the same department, the Department of Labor, that the scientists would be buffeted, if you will, by political winds that seem to happen more when regulation is the issue. As you know, certain political aspects of regulation are pro or con. So we are then in the Department of Health and Human Services, and our job is to generate new knowledge in the field of occupational safety and health through science, and then be able to transfer that knowledge into practice, whether it be in papers, scientific papers we write, or recommendations that we make to employers, to safety and health practitioners. It's also our responsibility to educate the safety and health workforce of tomorrow So we fund grants for students in industrial hygiene, safety engineering, occupational medicine, occupational nursing, occupational industrial psychology. That is another aspect of NIOSH's work. So in the Department of Health and Human Services, we are in the Centers for Disease Control and Prevention, which is one of the 12 operating divisions of the Department of Health and Human Services. Our role in CDC, as I mentioned, usually it's not as close as it is right now this past year and this year because of the pandemic. We do not deal with that much in the way of infectious diseases as much as CDC does. CDC, obviously, everybody knows, are the disease detectives that track down all of the issues related to infectious disease, whether it be Ebola in Africa or SARS coronavirus 1, SARS coronavirus 2. NIOSH doesn't usually get involved in those kinds of areas, but now the pandemic is all hands on deck. And because the pandemic affects the workplace, not only the workplace in which there are just employees or workers, like a manufacturing setting, but it also involves workplaces that are mixed. So it has workers and customers, non-workers in that workplace. Well, how do you best protect the worker when you have folks coming into that workplace that may be currently today unvaccinated? So that's a hybrid workplace, like a restaurant or a bar, a salon, a health club, a gym. The advice that we give has to be very specific to the industry sector. And that takes a while to think through.
You really laid out the structure, I think, of NIOSH, and that helps to even get that distinction between the two places that regulatory bodies are housed in and NIOSH is housed in, because it's really it's a way to keep the science separate from decision making. So I think you also hit on a lot of the questions going forward, and I'd like to kind of return to this as we move along this interview. Let me start off with, you talked about the distinction between regulatory bodies and NIOSH. So OSHA is the Occupational Safety and Health Administration, and NIOSH, of course, is the National Institutes for Occupational Safety and Health. And you are housed separately, but how do you come together? How are you related?
You're right. We are in two different cabinet level departments. OSHA's in the Department of Labor, and we're in the Department of Health and Human Services. But that doesn't matter to us. We are in constant communication with OSHA project-wise. If they undertake a standard setting, for instance, like they did recently for silica, our science informed their standard on silica, meetings staff to staff, manager to manager, OSHA administrator to NIOSH director. All of those interactions do not matter in terms of us being in two different departments. We are, as I always point out, we are joined at the statute. And that makes us very close collaborative partners, regardless of whether we're in two different departments.
Right. And in trying to understand how decision making on a regulatory basis and research and science are separate, how does NIOSH, I guess another way to think of it is, how does NIOSH influence policymaking and rulemaking?
A great question. We do that primarily by offering recommendations. Usually they can be qualitative or they can be quantitative. We can actually recommend that OSHA adopt what OSHA calls a permissible exposure limit, or a legal limit of exposure that workers should not be exposed above. We can say, we think your PEL, or your personal exposure limit for silica, should be X, Y, or Z. And indeed, for silica, we did that 42 years ago. And it took OSHA 42 years to do a silica standard. So just because we offer a recommendation doesn't mean that OSHA is going to run out and do it. And I think that's one of the issues that has bothered people a lot, is that OSHA doesn't take up every single one of our recommendations. And they have their own timeline for these things. Right. And OSHA rulemaking is a very complex process, even if when they decide to do a rule. So our job is to continue to generate the science, publish the papers, produce the recommendations, and OSHA OSHA isn't our only customer, so to speak. There are states, as you know, there are 26 states that are federal and 22 that aren't. Some of those state OSHA plans will look at NIOSH recommendations and do their own standard on the issue. Safety and health associations like the American Industrial Hygiene Association pays close attention to the science that we generate. So we have a lot of customers. OSHA isn't the only one. So I tell people not to feel bad for us because OSHA may only do a standard every 10 years. And they may not take up all of our recommendations immediately, but many others do. And in fact, I would point out internationally, that's true. NIOSH is one of a set of national occupational safety and health research institutes, many in Western Europe, in France and Italy and the UK, in Sweden, in Asia, in China, Japan, in Vietnam, for instance, that look very carefully at the NIOSH science and often will take up the NIOSH scientists' science also. So we have many customers internationally speaking.
So it's really setting the standard for multiple agencies across the world and here.
Yes, exactly.
Right.
Exactly.
Thank you. That's really helpful to know that, because I think we don't really think of all of the different aspects of it, and somebody on the outside, it really paints a pretty detailed picture of how NIOSH works and all of the different impacts it has. And I will come to that in a separate question. But in the meantime, let's say, looking back at NIOSH's history, what would you say are some highlights that the agency is especially proud of?
Well, there are so many of those highlights. It would be hard to summarize them quickly and in any order, and I'm sure people would disagree with me who have worked at NIOSH over the last 50 years and are very proud of the activities that they have accomplished. But I do think that in the early days of NIOSH in the 70s, for instance, NIOSH spent quite a bit of time creating criteria documents, which were formal science papers, if you will, quite detailed on particular chemicals or physical agents like asbestos. And those papers influenced OSHA's early standard setting in the 70s and 80s. And that was really the heyday of OSHA standard setting. And I think that's when the Occupational Safety and Health Act, as they envisioned it when they wrote it in 1970, actually came to fruition, where NIOSH would develop the science, develop a recommendation, OSHA would take that and do a standard. I think as the 80s and 90s developed, there probably was some diminution of that original kind of exchange, where NIOSH would continue to work on various projects, but they are largely separate. OSHA may not have taken up very many issues, and sometimes OSHA would, but were not successful. And I think the ergonomics research that NIOSH did and continues to do on the issue of musculoskeletal disorders with the issue of force, posture, etc., in the workplace, ergonomically speaking, resulted in a standard that OSHA did do, but it was struck down by the Congress, so it was unsuccessful. It didn't stop NIOSH from continuing its research in musculoskeletal disorders. In fact, we're still doing that. And one of the things we're doing now in here in 2021, as opposed to 1970, with MSDs, or 1990 with MSDs, as OSHA did the standard. 2002 was their standard that was revoked. We're looking at exoskeletons right now. As you know, they are apparatus that are strapped to the human body, and we're looking at whether the apparatus itself, which is touted to prevent musculoskeletal disorders by amplifying the movements, chiefly the shoulders and the lifting capability of human being, whether they are causing new MSDs that we did not know about. So as technology proceeds, NIOSH studies it. and we have a significant amount of research in areas of robotics and other technologies that we're beginning to see in the workplace. So again, even though we all know that it would be fairly rare and probably unlikely for OSHA to do a robotic standard or an exoskeleton standard, or a standard in some of these new areas in the future of work, like nanotechnology, for instance. That doesn't stop NIOSH from continuing to do research in that area, because our output is a scientifically based recommendation for safety and health, regardless of whether OSHA does a national mandatory standard.
So it's in the evidence, and the recommendations are based on evidence, but I imagine there would be, it sounds like on the application of those recommendations that OSHA would have extra considerations in mind that would prevent them from potentially implementing all of those recommendations into standards. So,
sure, as I say, OSHA standard setting is very complex, but other employers, let's say, that are in the advanced manufacturing area where nanomaterials are being used more and more, will pay close attention to NIOSH. And in fact, I'd like to mention at this time, if I could, that national mandatory standard setting isn't the only game in town. And in fact, private sector consensus bodies that create standards are very much alive, whether it be the International Standards Organization, ISO, ASTM, or others like ANSI, the American National Standards Institute. And NIOSH scientists participate in those consensus bodies to be able to develop occupational safety and health standards based on our science. So again, that's another output that then employers often use. They recognize it as important and use it in their workplaces, even though there may not be a traditional OSHA national mandatory standard.
that's especially interesting. And it sounds like also from thinking of the pace of standards and thinking of the pace of research, you make a fair point that, with OSHA may be slower in implementing developing standards around it and implementing those recommendations, but with the science, it's possible to move quicker and investigate issues that are emerging on a day-to-day basis. So
yes, I think that's a good description. Again, the framers thought that NIOSH recommendations would always be taken up by OSHA. OSHA would always be doing a standard. But that really has not been, I think most people would agree, how we turned out 50 years later. But it hasn't, again, stopped NIOSH from taking the science and making recommendations for a wide array of customers to use.
Exactly. And there's nothing preventing organizations from wanting to take up on those recommendations and implementing those anyway. So that's very interesting to know. So moving on, you led NIOSH for several years now. So you first became director in 2002. That's just after the 9/11 attacks. And you led efforts to investigate the health impacts for a lot of the rescue workers. And we know that some of that work is continuing today. And now here we are, in the midst of a pandemic and a whole new bunch of worker well-being issues. So looking back at it's 50 years. So what are some of the critical drivers that have impacted your work and also the work at NIOSH, but also how does an institute like NIOSH respond to emerging situations like COVID, which really have a global impact?
Well, it's a really great question. And I think we're looking back on 50 years. And I think originally what the framers of the Occupational Safety and Health Act, and certainly NIOSH through its earliest history, probably the 70s, the 80s, the 90s, it was primarily and exclusively a prevention research agency in safety and health. And that's what most people think of when they think of NIOSH. Oh, they do prevention research in occupational safety and health. And indeed, we do. We do a lot of that. and that is still a primary but not exclusive part of what NIOSH does. In 2000, for instance, the Energy Employees Occupational Illness Compensation Act was passed, and that act, signed by President Clinton, gave compensation to atomic weapons workers who worked on and continue to work in the nuclear arms weapons field, where ionizing radiation is an issue. So when the Congress wanted to develop a program to give compensation to those workers, the compensation program was housed in the Department of Labor. But one of the questions that the Department of Labor could not answer is the issue that the Congress said they had to answer, which was, we're not going to give compensation to workers unless their work was more likely than not to result from, their cancer was not more likely, was more likely than not to result from their work with ionizing radiation as an atomic weapons worker. So DOL does not have that capability scientifically to make that determination. So that came to NIOSH. So we have a workers' compensation program in NIOSH as of 2000. Next, as you pointed out, came 9/11, and workers were affected by the cleanup process and their response work with a number of different carcinogens and chemicals that were involved. In fact, we've listed them in a document. There are about 267 of them. And they began to develop not immediate illnesses, but more long-term illnesses. And Congress passed a health plan for them, the World Trade Center Health Program. Well, they looked around to see who would best be able to host that program. CDC does not have a patient-oriented, if you will, program. They are a public health agency. NIOSH did prevention research and a compensation program, but they said, no, NIOSH, we want you to take on being the host of this health plan. So as of 2011, we now have, as you point out, the World Trade Center Health Program. It's a health plan, a federal health plan. We now have over 100,000 members, and the NIOSH Director is the administrator of the World Trade Center Health Program. So yes, we still do old-style prevention research for the past, the present, and the future, but we also do workers' compensation, and we also do a health plan.
That sounds all very fulfilling, because knowing how much goes into disaster management and figuring out how to even compensate, and in a long-term manner, I think that so that sounds really meaningful and fulfilling. Thank you for describing that. Thinking more along those lines, I would imagine we're probably going to have more and more of those issues. For example, sedentary behaviors. I mean, it's hard to really draw a clear distinction right away for the amount of musculoskeletal impact it can have, the psychosocial impact, but I want to get to that next. And so thinking more around changing needs for worker well-being and really what the future of work looks like. For example, I'm doing this interview from my house, and I imagine a lot of people are working from their home. And as you mentioned, NIOSH has had to expand its focus from these traditional workplace exposures. And I certainly didn't know that NIOSH hadn't looked for biological exposures, hazardous exposures. And so adding those layers of chemical, physical workplace hazards, biological workplace hazards, how would you begin to address complex issues like diversity, psychosocial stresses, equity, inclusion, and really work as a major determinant of health and well-being for people?
Well, another great question. And I'd like to point out that NIOSH for over 25 years has done work in the psychosocial area. We have behavioral scientists that work at NIOSH. We're not all chemists or epidemiologists. These are psychologists that specialize in the area of occupational psychology. And this has been an issue for us for quite a while, as has been chemical hazards, biologic hazards, physical hazards. And recently, I think probably in the last 10 years, we began to look at combining these together, because a worker can be exposed to these very tangible, let's say, chemical hazards, but they can also be exposed to organizational hazards, how a particular workplace is organized, supervision issues, how they're treated, as you point out, as a worker in terms of diversity and inclusion, and the mental stresses that are associated with work, which can come in all sorts of different varieties and from all sorts of different inputs. And so, as you mentioned, this umbrella term of worker well-being encompasses both the physical and the psychosocial aspects. And it's a complex area. It's one that we like to refer to and have created a program around called Total Worker Health, meaning let's not leave anything out that can influence whether or not a worker has worker well-being. We want to include everything, because if you leave something out, you're not solving the whole picture for that worker in that workplace. And employers more and more have become very interested in this aspect of it, the psychosocial issues. Some people say, well, this is a touchy-feely thing. Well, it may be touchy-feely, but it's real nonetheless. And in fact, if you look at the World Health Organization's top 10 issues that we're going to be facing in the future for the workforce, depression and anxiety are right at the top of that. The issues that have been, I think, informing all of us, that have been researched over the last 10 years, the presenteeism issue, actually being at the workplace but not really being present there because you're worried about this or that or the other thing. So I think the issue about total worker health is now creating a more holistic picture of the worker. The goal, as you mentioned, the outcome is worker well-being. We want to look at all the inputs that are impacting the worker, from not only the traditional hazards that NIOSH has studied for many years, but also from the organizational hazards that are inherent in the organization that we're in and the type of work we're doing, including workers who don't necessarily have an organization, like the contingent worker, so to speak, the worker that has a platform that they go to every day to connect with their customers, is still a worker, despite the legal controversy in various states and various countries about whether they're independent contractors or workers. They're still working, and they're still included. So I think the issue that we've been able to use as a vehicle for both research and service and interventions is the vehicle of total worker health.
Thank you. I'm really glad you brought up total worker health, because it really gets at that crux of our work experience and also our non-work experiences, so to speak, and how really it impacts one person as the employee or the working person. And one of the, as you mentioned, NIOSH's programs, Total Worker Health, and as our listeners know, we at the Oregon Healthy Workforce Center are a Total Worker Health Center of Excellence. And as part of this focus, we've been able to investigate and propose interventions that address some of those complex issues that not only directly affect people at work, like accidents and injuries on the job, but also work experiences that you take back with you, like how your supervisor treats you, or whether you have a welcoming, positive workplace culture and having job security, all of which can really have an effect on their well-being. But as you were speaking, one of the points that came up to mind was, I imagine that these are eventually recommendations that we can draw around. These are issues that could be amenable to recommendations, but I also wonder how much of this can get translated into standards from OSHA. So some of those complex issues, like, as you mentioned, the umbrella worker well-being term that encompasses not only injury, pain, illness, but also feeling like you're included in the work experience, and how that translates to your family and work-life balance and all of that. So that will be an interesting next few years, I would imagine, as the future of work evolves.
You raise a very challenging issue. OSHA standard setting has been substance specific, if you will, topic specific. Narrowing down the issue has been where OSHA has done its primary standard setting. I really don't see OSHA as the vehicle that would be able to help influence, other than joining the rest of us and OSHA has, in supporting the idea of total worker health. But I don't see this as a standard setting issue. Now, there are some standard setting organizations, ASSP, that are working on a total worker health type consensus standard. It's going to be interesting to see how they come out in threading that needle. But I don't see it as necessarily a standard setting issue. I think it's a way of practice, a way of looking at the workplace as a holism, and not splitting it up into various aspects that we've traditionally done. And I think we're seeing that in many, many different areas. One example I'll give you, which may be a very odd example, but as you know, there are 17 states now that have legalized adult use of cannabis. Now, some of those states have said that employers cannot use the laws to discriminate against workers who use cannabis outside the workplace. No state has condones cannabis use at the workplace or a worker being impaired by cannabis. But this issue about a activity that occurs outside the workplace that may affect the worker coming to work, being at work, I think is an example of and there are many, many, many like that. The worries that you pointed out that a worker could have about the way that they're supervised creates anxiety both in their private life as well as their work life. And so there's sort of an endless list of these activities that I think we have to tackle. And so that's just one example of some of these outside issues that impact the workplace. Workplace is a very unique place, and workers bring their whole selves to work. They don't partition themselves and bring only a part of themselves to work.
Absolutely. Yeah. And I think that's the not putting it into boxes that you can really control and say, this is how you should do this versus that, I think allows the freedom to really think globally about work and think kind of in integrated ways about the daily work experience and how we can really work toward improving all of that to for whether it's safety, isolated, like whether you're looking at wellness, but really looking at this whole picture of mental, physical well-being. So it's really, really good point.
Yes, I think you hit the nail on the head when you're using words like integrated and holism. That's the new view, and I think it's going to be the future view. It's a much more complex job for safety and health professionals to do that kind of research, and there are total worker health centers like your own that are trying to help us figure out how do you do that kind of research where you're not isolating a particular item, but you're looking at the totality. And hopefully you and other centers can help us with regard to how we do that kind of research.
Right. More to come in the coming years, I'd say. How does NIOSH, you spoke to this a little bit in one of your previous points, but how does NIOSH respond to state level needs? So for example, here in Oregon, agriculture is a big industry, as is forestry logging. And I imagine it would be challenging for one federal agency to address regional needs across the country.
Well, yes, it is. And we conquer that problem by having agricultural safety and health research centers, as we do total worker health centers, and education and research centers. So we have a lot of centers that we fund throughout the United States that are located in all regions of the United States that they're really excellently situated to understand regional and local issues. As you mentioned, Oregon agriculture is different than Iowa agriculture. So the two centers we have in that area, the centers we have in California and Minnesota and all throughout the United States, that's their job, is to be able to look at those issues that are regionally important. And that's how we do it as a national institute. We only have offices in 8 different states, but we have so many partners in these centers that we fund throughout the United States. Without them, we couldn't really accomplish some of the goals that the statute sets out for us.
Thank you. That's really helpful, helpful to know. Okay, so moving along, again, you seem to speak to all of my all of the questions in this interview ahead of time, so so thank you for that. But I would like to return to this question about your target audience. So obviously academic institutions seek funding from NIOSH, like we do. We conduct research on various worker well-being issues. Policymakers are interested in NIOSH's recommendations. You mentioned practitioners, you mentioned students in academic programs that are for people that are going into training for occupational safety and health practice. But I'm also thinking, what about, especially as gig work continues, especially as independent contract work continues, how does NIOSH move some of that research to impact individual people directly?
Oh, great question. I did want to amend your list of customers there, just because we forgot to add to our list labor unions as customers and
That's right.
worker
Thank you.
advocacy organizations like the committees on safety and health, the COSH committees that are throughout the United States. Those are also customers of ours that relate to our science and recommendations. So we certainly don't want to leave them out of the list there. The issue that you're bringing up is the non-traditional or non-standard employment arrangement. But as I said, they're still workers. And we are studying that population too, to understand what issues are affecting them in their work. The non-standard work arrangement, or the independent contractor arrangement, as some people would prefer to call them, is a challenging one because they do not have a traditional employer, nor are they covered by the safety net that was developed from the 1930s on, especially with regard to safety and health protections under OSHA standards. But that doesn't mean that NIOSH can't look to see what are the issues associated, what are the injuries and illnesses associated with that, what kind of hazards are they exposed to, what kind of issues do we need to look at there. It's a tough group to study because we're not 100% sure who they are. The Bureau of Labor Statistics has had trouble defining who they are and even counting them. We know, for some of you who may be familiar with that, it is challenging. But it is something that that they are part of the American workforce, and increasingly a larger part of the American workforce. So we can't leave out those folks, just like we have not left out temporary workers. As you know, Russell Kelly, right after World War II, decided to put a company together called Kelly Girls, to provide administrative office support work, primarily for women who had been displaced from the factory during World War II, where they had worked, and they enjoy working and getting out of the home, and they wanted to continue. So Russell Kelly began hiring them. Well, now they're called Kelly Services, and they're a gigantic company that provides temporary workers. So we have workers that have 2 employers. The agency that sends them out and the host employer that actually has them in their workplace. And they have specialized hazards, especially with regard to their newness often in a workplace. We've looked at that issue, it's been studied. The issue about their reticence to be able to bring a safety and health issue to the attention of the employer because they're there for 1 day or 2 days, and they're going to be out if they start complaining about safety. So there's a lot of issues associated with temporary work that we've been studying probably since the 90s. Well, this gig work, as you have brought up, is just the newest sort of angle on American employment. But they're still workers, and we need to study their hazards.
And looking at other populations, as we look at worker well-being, is underrepresented groups that, in the larger, whether it's science and investigations and even in rulemaking, and where a lot of groups aren't able to, groups from diverse occupational groups or BIPOC communities, for example. Some of the science and some of the recommendations that come out, how much do they include experiences of, say, farm worker or migrant worker communities? And I imagine there are always challenges to get to address all of those levels.
Well, certainly without a traditional employment situation, without, let's say, being represented by a union, these types of workers are harder to get to. Oftentimes, migrant workers, obviously because of the name, they migrate, sometimes from one country to the other country in various agricultural flows. So these are all challenges to studying hazards associated with various workers, but that's our job, and researchers have to figure out ways to reach those workers, and our agriculture centers have done a great job looking at migrant farm work. Our agricultural center at UC Davis, for instance, has really excelled at looking at migrant farm hazards associated with their work.
Great, thank you. So, Dr. Howard, in thinking about all of the events from this past year between the pandemic and race-related unrest, how does NIOSH address issues around racial justice and health equity from a worker safety and well-being perspective? Is NIOSH able to respond to those issues?
Well, yes, and I would say NIOSH has responded to those issues for 50 years. And the reason why I say that is because vulnerable workers who have a higher, let's say, incidence of injury and illness, often are the most socioeconomically disadvantaged of the population, whether they be Black or Latinos or other people of color or other socioeconomic classes, because as you know, new entrants, foreign entrants to the United States frequently take the worst jobs, i.e. the most hazardous jobs. And that seems to be true in every country, and it's certainly true in the United States. So NIOSH has always focused on that group because they are the ones with the highest levels of injury and illness. Recently, I think you referred to issues that have happened in the last year or two. NIOSH is part of CDC's Health Equity Initiative, in which we're looking across populations to be able to focus more on some of these health equity issues, as we're facing now with vaccination for COVID-19. We find that the diminution in the number of Blacks and Hispanics, for instance, that are getting vaccine is less than their proportion in the population. Whereas if you look at Caucasians, the number of Caucasians that have got vaccinated is overrepresented in terms of the population. So we have a lot of work to do to bring the vaccine, if you will, and the administration has just decided to sort of change their way of doing vaccination to create mobile units that bring the vaccine, maybe to construction sites, maybe to neighborhoods that are more disadvantaged socioeconomically. So I think NIOSH has always had an interest in that category of workers because that's where the injuries are occurring. Except now we can expand it and put it part of a larger federal government health equity initiative.
Thank you. That is actually very helpful. So I want to go back and address this point about research to practice a little bit more. So NIOSH has the translation research program, and then also the R2P program. Can you tell us more about these?
Well, they grew out of probably 20 years ago when it became obvious, and everybody knew it ahead of time. It wasn't like it was a big secret. Scientists, people with PhDs and advanced degrees and researchers, they are used to publishing a paper in an academic journal. And as you know, being at a university, your whole appraisal system is oriented around how many papers did you publish and how many citations did that paper have and all that sort of thing. Well, okay, fine. That may be super for academic centers, but for a taxpayer-supported institute that's supposed to be delivering product to all these customers that we've been talking about for the last hour, that doesn't really work so well because nobody's reading those journals, even though they're fine journals. And indeed, all of us scientists may read them, but not everybody reads them. And then we have the translation problem. Even if you do read the article, if you're not in that field, you may not understand what the heck it's saying or how to apply it. So this issue of moving the research to practice, or R2P, became a very big issue about 20 years ago. And we've spent quite a bit of time saying, look, sure, it's great to get that paper in the research journal, but then you have an obligation to translate that and apply it so somebody can apply it easily that doesn't understand all the intricacies of your research into their practice, whether it's a safety health practitioner, a worker, an employer, whatever. So that idea of moving research into practice involves some translation ability. And that's where our R2P program is oriented, is to bring more of those findings from the fancy science into plain English and being able to be applied in the workplace by people that don't necessarily want to read all those fancy journals.
I love that you said that. Translate the fancy science into basic plain English, because that is exactly a huge challenge with academia. And we do the work we do, and it is so incredibly important to publish them in peer-reviewed journals. And I'm really happy to note that, even in our new work these days, especially with the Total Worker Health Centers, also dissemination and science communication is such an important piece, because ultimately your information is only as useful as it gets to the target audience. And so I'm really happy.
And I want to point out one example that CDC has recently done. If you read MMWR, which is the Morbidity, Mortality Weekly Report CDC puts out, they now put a little box in each of those articles that summarizes why is this article important, et cetera. It's a very small box. It may have 100 words. And I find myself going to that box on a regular basis just for timing issue. And then if it's really something that I need from that box, I will go back and read the article. But we're all moving in that direction, is being able to quickly communicate the findings to people. And I think your example at your university of having folks that are into the science of communication. We thought, okay, communication is you publish the paper, you write a little something, but the science of communication is much more complex than that. And we need specialists in that area to help other scientists figure out how do you communicate well. And I know at NIOSH, we have those folks that are in charge of translation to be able to translate the science into workable solutions that people can apply.
And that would be incredibly important, I think, moving even further when people like contract workers or independent workers, people in non-traditional work, look to NIOSH for information on how they can navigate the work experience for themselves without having the support of organizations or having a mandated rule to follow. So that is incredibly useful, that translation piece.
Right. And I would tag on to that. I think you really made a very important point. That particular kind of workforce is now being experimented with, if you will. There are certain tech platforms, like Uber, for instance, that are looking at, and Senator Warner, of the senior senator has posed legislation on this issue, making a lot of the safety net benefits, like workers' compensation, health insurance, portable, so that they go with the worker. Well, the same sort of thing we can imagine having that health and safety knowledge become portable with those workers. We've got to figure out a vehicle by which we can use to give to those workers and a way to give it to them. But we've got to figure out, okay, you're a TaskRabbit gig worker. So what do you need to know about going into homes? Like we teach home health aides about security issues, etc. So I think that this is the new world of workplace, part of the new world of workplace that is quite exciting for researchers in universities like yours that are going to have to push our boundaries and be able to figure out how to do this.
That is for sure. And I imagine we'll be, with how quickly and how much work is evolving, I imagine we'd have to push a lot of boundaries at a pretty quick pace as well. So great point. I think closing out, and as we do, I'll ask, what's next for NIOSH? What do you hope the agency will be celebrating at its 100th?
Well, first of all, it's been a pleasure for me to talk to you. It's been a pleasure for me to talk to you about NIOSH's work and to celebrate our first 50 years. I think the second 50 years of NIOSH will probably be as unrecognizable now as somebody who worked in 1970 looks at NIOSH now and thinks, wow, that's not the NIOSH I worked for. But we have to be responsive because the world of work changes, and that's what we're tied to. So we have to be nimble, we have to be scientifically creative, and we have to be able to communicate health and safety messaging in a way that everybody can understand us.
It's a great note to end on. Dr. Howard, this has been wonderful. Thank you so much.
Thank you.
We look forward to we look forward to so many more years of research and impact and for worker well-being. And someday, somebody will be interviewing some from NIOSH on its 100th, and it'll be fascinating.
It will be fascinating.
On behalf of the Oregon Institute of Occupational Health Sciences and the Oregon Healthy Workforce Center and NIOSH Total Worker Health Center of Excellence, we wanted to congratulate NIOSH for their dedication and hard work the last 5 decades of service and its evolution to recognize the importance of improving safety, health, and well-being in the workplace. In the show notes, we'll provide some ways to stay connected with NIOSH and celebrate their 50th anniversary milestone. Thanks for listening. Do you have an idea for a podcast episode? Well, we want to hear from you on important workplace issues that you would like to discuss. Email us at occhealthsci@ohsu.edu. That's OCCHEALTHSCI@ohsu.edu. Subscribe to the Oregon in the Workplace blog or follow us on our social media channels on either Facebook or Twitter to stay updated on current research, resources, news, and community events.